Hi, hello everyone. Welcome to Dr. Ravichandra Official. Please like, share, and subscribe Dr. Ravichandra Official for more interesting videos on pathology. Today, in this video, we will discuss a topic from infectious diseases, that is typhoid. Typhoid is an acute infection caused by Salmonella typhi, so called as typhoid fever. Salmonella paratyphi causes paratyphoid fever, which is similar to typhoid fever but is in milder form. Enteric fever includes both typhoid and paratyphoid fevers. Salmonella typhi is a gram-negative anaerobic bacilli, and boiling or chlorination of the water and pasteurization of the milk will destroy this bacillus. Coming to the sources of infection, patients suffering from the disease, infected urine, feces, or other secretions from the patients are the sources of infection. Along with this, chronic carriers of typhoid will also cause typhoid infection. Mode of transmission, ingestion of the contaminated food or water, mainly dairy products. It can be direct spread, rare by finger to mouth contact with feces, urine, or other secretions. Incubation period will be around 7 to 14 days. This is a beautiful picture showing what is going to happen in a typhoid fever. So, with the ingestion of water or food contaminated with the Salmonella typhi, the Salmonella typhi are able to survive in the gastric acid of the stomach, will penetrate into the ileum. There, the Salmonella typhi penetrating the mucosa and are phagocytized by the mononuclear phagocytes in the Peyer's patch. Salmonella typhi will reach the mesenteric lymph nodes and there it will multiply. The Salmonella typhi are carried through the lymphatic system and bloodstream, and the Salmonella typhi will colonize in the reticuloendothelial tissues like liver and spleen. The Salmonella typhi will multiply in the gallbladder, then they are discharged into the intestine, and it involves the Peyer's patches of small intestine. The morphology of the typhoid can be the lesions can be intestinal and extraintestinal. Coming to the intestinal lesions, grossly the terminal ileum affected most common, but the lesions may be seen in the jejunum and colon also. Peyer's patches will show oval typhoid ulcers with their long axis along length of the bowel. So this is a characteristic point that will discriminate the typhoid ulcer from the tuberculous ulcer. The base of the ulcer is black due to sloughed mucosa. The margins are slightly raised due to inflammatory edema and cellular proliferation. The regional lymph nodes are enlarged invariably. This is a picture showing the typhoid ulcer. You can appreciate the arrow that is indicating the longitudinal lesions. And the peripheral smear will show most of the times lymphocytes. Microscopically, there will be hyperemia, edema, and cellular proliferation consisting of phagocytic histiocytes, showing characteristic erythrophagocytosis, which is shown in the previous picture, along with the lymphocytes and plasma cells. So, enteric fever is an example of acute inflammation. Leukopenia with neutropenia and relative lymphocytosis is also seen in peripheral blood. Main complications of intestinal lesions of the typhoid are perforation of the ulcers and hemorrhage. Coming to the extraintestinal lesions, the lesions that are outside the intestine. Typhoid nodules. These are focal granulomas consisting of macrophages, ingested bacilli, RBCs, and lymphocytes. And these extraintestinal lesions are common in lymph nodes, liver, bone marrow, and spleen. Mesenteric lymph nodes will show hemorrhagic lymphadenitis. Liver will show foci of parenchymal necrosis, whereas gallbladder will show typhoid cholecystitis. And the spleen will be enlarged called as splenomegaly. Kidneys, there will be inflammation leading to nephritis. The abdominal muscles will show Jenker's degeneration, glossy or waxy hyaline degeneration of the skeletal muscle. There will be arthritis, osteitis, meningitis, and even orchitis. Coming to the clinical features, it is gradual in onset with an abdominal pain, bloating, nausea, vomiting, diarrhea, and there will be step ladder type of fever. That is continuous rise in the temperature of the body. There you maybe even appreciate the rose spots. What are rose spots? These are small erythematous maculopapular lesions on the skin, fade with pressure, and they will appear on the chest and abdomen during the second or third week. Spleen will be soft and palpable and sometimes may accompany with the hepatomegaly. Coming to the complications of the typhoid fever, with intestinal lesions, there may be perforation of the typhoid ulcer and hemorrhage from the ulcer. Extraintestinal lesions may lead to encephalopathy, meningitis, seizures, pneumonia. There may be sickle cell disease patients who are susceptible to salmonella leading to osteomyelitis even. Carrier state is persistence of the bacilli in the gallbladder or urinary tract. There may be general complications like toxemia, dehydration, peripheral circulatory failure. Coming to the laboratory diagnosis, blood culture, stool culture, and urine culture will help in the diagnosis. Blood culture will be positive in the first week. 90% of the patients remain positive, will show that, and they will remain positive in second week till fever subsides. Rapidly, they become negative on treatment with the antibiotics. Stool cultures will be positive in second and third week. Urine culture will show 25% of the patients by third week. That is, you can diagnose typhoid fever using urine culture in 25% of the patients by third week. Coming to the other test, Vidal reaction, which is a classical test, according to me, it will measure the agglutinating antibodies against the O, H, and VI antigens of Salmonella typhi and H antigens of Salmonella paratyphi A and paratyphi B. Lack of sensitivity and specificity is there, and this will be positive from end of the first week till fourth week. So with this, our topic of typhoid fever will complete. This typhoid fever can be asked for a 6 marks question or 3 marks questions, and very rarely in the MCQs in the upper one. Thank you for your patient listening. Please like, share, and subscribe Dr. Ravichandra Official for more videos.